Dr. Dale Bratzler is the Chief COVID-19 Officer at the University of Oklahoma, and he joins us now to talk more about Moderna's vaccine authorization. And Doctor, let's start with last week. We were all ecstatic. There was this euphoria about the Pfizer approval. Today, still 3,000 people a day dying, not to downplay what this means tonight. So we'll ask you your reaction to this new approval tonight of yet another vaccine and what it means.
Yeah, so we're really happy about it to have two vaccines now. Have slightly different characteristics that'll make the Moderna vaccine a bit easier to use in rural communities and doctors' offices and pharmacies. But now we have two different vaccines with a large number of doses that have already been ordered by the federal government. So we're really looking forward to getting those into the arms of people who are at risk of the complications of this particular disease.
Doctor, we have heard numerous times as these vaccines begin to roll out that we still cannot let our guard down. We have to socially distance, we have to wear our masks, we cannot gather in large groups. But at what point, what has to happen once these vaccines are made available to more and more people? Will we get to a point where we can get back to some normal activities, hugging our family, going out to dinner?
Yeah, I certainly hope so, and I want to get there myself. So a couple of things I think we need to watch for. First is we need to see those case counts in the United States starting to come down. As you know, a couple of days ago, we had nearly 250,000 new cases in the United States, and that's just not sustainable. We need to see those case counts come down. Secondly, we need to see the number of hospitalizations come down. You know, our hospitals across the country are really strained. Our ICUs are strained. The healthcare workers taking care of those patients are fatigued and have been under great stress now for months. So we need to see the number of hospitalizations come down. I think as we see the vaccine rolling out and getting it into those people who are at risk of the complications of the disease, we can start to see not only the case numbers start to come down, but most importantly, in my opinion, see the number of hospitalizations and deaths come down.
And Doctor, I want to hit these 2 points hard. I think this is a question a lot of, basically everybody has. Number one, we don't have an answer yet, correct, on the issue of durability, meaning once I get this shot, both rounds of it, how long am I immune? A few months, few years, forever? And then two, even after I get the shot and I'm done, can I still infect someone else if I happen to catch COVID?
Yeah, so I'm going to answer the second question first about can you get COVID and potentially not get severe disease, because both of the trials of both the Moderna vaccine and the Pfizer vaccine looked at the prevention of symptomatic disease, but they didn't carefully look at whether or not you could still get infected or even potentially spread the virus. I think, though, we'll have that information relatively quickly. With respect to duration of immunity, we don't know yet. Remember, these vaccines just started in their clinical trials just a couple, 2 to 3 months ago. So there is no long-term data on duration of immunity. But I think there's a lot of good hope that we will see sustained immunity for at least some prolonged period of time. I can't tell you, and nobody knows at this point, whether at some point in the future we'll need to take booster doses or not.
Doctor, we just have a few seconds left, but we heard over the Thanksgiving holiday not to travel. We're hearing it again. What would you tell people whose plans are already in place?
Yeah, if you're going to be traveling, certainly wear a mask. I mean, if you're traveling, if you're in public transportation, put a mask on before you get to the airport or train station, wear the mask throughout. If you're going into a home of people that you don't live with, wear a mask as much as possible. If the weather allows, take activities outdoors, avoid large crowds. Remember all of the interventions that we need to do to prevent the spread of this particular virus.
Dr. Dale Bratzler with the University of Oklahoma, appreciate your time tonight. Thank you.
Yeah, thanks for having me.